Hello, everybody.
Hi.
Hope y'all are having a good evening so far. We are going to give everyone just a couple of minutes to join us in the webinar room. We're waiting for a few participants, so I know how it is. Everybody's probably shuffling around trying to get ready and join us tonight. So bear with us. We'll go in about 2 minutes. Welcome back, everybody. It's week 2 of our core and pelvic floor webinar. This week is the core. I'm Dr. Kelly Bernard.
And I'm Dr. Christina Melandris.
And here we go. Buckle your seatbelts.
Yay.
Before we take off on our adventure, we're going to recap week 1. So we did have a few questions last week. I think everybody got some good info on diaphragmatic breathing. But we had a couple of questions we'll go through. Before we address the questions, we do want to mention a couple of housekeeping things again. Everyone, turn your volume up. If you're having any trouble hearing us at all, you can let us know, type in on Q&A if you cannot hear, but definitely make sure on your end that your volume is turned up and that your mic is turned down or muted for your mic.
We're troubleshooting sound as we go too, so please bear with us.
We want to make it the best experience possible. So do give us feedback if anything is going on there. And we have a few more participants who have joined us. We're so excited. They've joined online after week 1 started. We have extended the registration, so spread the word to friends and family. Anyone you feel that could benefit, we'd love to have people join. With the registration extended, they are welcome to view the recorded webinars at any time. So they don't have to be here for our live webinar, although we love that participation. Recorded version is just the same. They'll see what you see. And so let's get to our Q&A.
So a couple questions we had gotten last week, as Kelly mentioned, we weren't able to get to at the end. But one of the questions last week was, I'm currently pregnant. What modifications, if any, do you recommend for these exercises? So last week was mainly just the breathing exercise, the diaphragmatic breathing on your back. The only modification for that, if you're pregnant, would be, if you're at that point where your OB has advised you not to lie flat on your back, you just want to be kind of in a reclined position. So you can definitely, if you have like a wedge pillow, or you can stack a few pillows to be up so that you're not totally flat on your back. But the open book exercise is safe to go through as long as you're doing it comfortably in a range of motion that you feel okay with, that's not hurting. But otherwise, those are pretty gentle. This week, we're going to show you some modifications because we're going to get a little bit more in depth as far as like strengthening exercises. So we want to make sure that y'all have options. If you are pregnant or are unable to get into certain positions, you have a variety of options this week too.
Yes. So as we progress, definitely keep those questions coming if you're uncertain about anything. And another question we received was, I could not feel the pelvic floor moving during this exercise. And I think that was in reference to the diaphragmatic breathing. It is a common thing that patients will sense, or in this case, not sense the pelvic floor. So getting that feedback from your pelvic floor takes time and practice. Initially, doing a diaphragmatic breath really is not going to make your pelvic floor feel like it's moving. The main goal is to be able to relax the pelvic floor on that inhale from week 1 practice. And as we go into pelvic floor and get a little deeper, you will learn those recruitments, that proper contraction. You'll really definitely want to have the feedback then of your pelvic floor contracting. But for now, with breath work, it's okay if you don't feel it. The more you practice, the more fine-tuned your sensory system will get.
And just know some of that is happening reflexively as you're going about your day. So sometimes it's not a huge awareness you have around that too.
So this is Bill. Bill follows his home exercise program. His mobility is improving. Bill is smart. Be like Bill. So we just wanted to include this funny little cartoon because we definitely have this on a daily basis with our patients. The encouragement factor, the motivation factor to keep going and keep repeating your home exercises. The reason why it's so relevant to repeat your home exercises is because that is laying down those pathways that are new, and you're forming new habits of motion. You're forming new sensory feedback pathways too. So that whole sensory motor system will respond and learn the more you practice. And if you don't do your homework, you really won't experience the gains. And that'll be sad because you're committing already to it. So just do your homework, be like Bill.
Right. So this week we are diving into the core. So the actual core muscle. So we're going to do a little bit of anatomy as we did last week, and as we're going to continue to do at the beginning. We're going to talk about the transverse abdominis and the multifidus muscles. We're going to discuss a little bit of injury prevention, why these things matter, kind of what big picture role they play. We're also going to touch on diastasis recti. And then we're going to finish up with exercises at the end that is activating a lot of these core muscles.
Okay, so this hopefully is familiar to you from week 1, the functional cylinder. So we just want to hit that overview again. Anatomically, we're going from the diaphragm, which we learned a lot about last week, and into the transverse abdominis, the core muscle groups of the transverse abdominis in the front of the cylinder, and the multifidus is a spinal muscle in the back that you will all get to learn more about this week. And then the pelvic floor as the bottom of the cylinder. So when you envision that 3D cylinder, that's again just that anatomical overview that we're diving a little bit deeper each week.
All right. Are y'all ready?
Let's talk about the core. This week, we're really going to focus on the core musculature. So there are a couple muscle groups that encompass the core, but the two most important are the transverse abdominis and the multifidus muscles. We're going to kind of explore these a little bit more deeply this evening, talk in detail about their anatomy, how they function, but we always like to give people a visual of these core muscles as a corset and laces. So thinking of your transverse abdominis muscle as a big corset muscle that wraps around, and then the multifidus acts as the laces along the back of the spine. So let's go into more detail. The first muscle we're going to talk about is the transverse abdominis muscle. We like to refer to this as the corset muscle. You can kind of see why in this picture to the right. It is such an enormous muscle. It actually attaches onto the spine and then wraps all the way around from the spine to the front of our trunk. So you can see how massive this muscle is, how many areas it attaches to. It attaches to the ribs, to the lower back, to the pelvis. This is why this muscle is so important and plays such a huge role in stability of the spine, the core, the pelvis, pretty much everything. It is the deepest abdominal muscle. So if you look to the picture on the left, the rectus abdominis is your outermost abdominal muscle. That's kind of when you see where there's a six pack. If we go deeper, then we go to external obliques, internal obliques, and then the transverse abdominis is actually the deepest of all of those. So when people are doing crunches, working on their abs, this picture might give you a little bit more of a visual as to why the rectus abdominis, or your six pack, really plays no role in stability of the spine. It's not even touching your spine. Your transverse abdominis is so deep in there and it's up against all of these joints in your body. Another thing to note is your transverse abdominis actually has a muscle-to-muscle connection to the diaphragm, which is pretty cool. Again, you can see how that can be such a big player in stability of that area, as well as helping with abdominal pressure. So pressure within this whole core cylinder that we've been talking about. This is kind of the first line of defense between everything inside and working our way out into those muscle layers. Another important thing to note is that the transverse abdominis and pelvic floor muscles actually contract together. So when you're engaging in some Kegel exercises, sometimes you're going to get a little bit of transverse abdominis contraction there as well. So again, that kind of feeds into how that really helps to provide stability of the pelvis, of the sacroiliac joint, which we're going to go into more detail about next week. But it does play a huge role in giving all of these joints and structures a lot of support. And you can see, because of all this, how weakness of this muscle can lead to increased movement in the pelvis and kind of a breakdown in function in some of these areas. Did you know that the transverse abdominis is the first core muscle to activate prior to limb movement? They've done a lot of research on this over the years, looking at the role of different abdominal muscles and core muscles and their relationship to arm and leg movement. So they looked at muscle activation patterns and EMG activity of different muscle groups in the abdominals and core and arms and legs as well. But what they found was that as soon as your brain made the decision to move an arm or a leg, or any of those joints on either end, that transverse abdominis muscle is the first muscle to kick in. So isn't that kind of cool? That muscle knows that it has to kind of provide that support and stability of that cylinder to allow for more ease of motion of the arms and legs. So this kind of reiterates why this muscle is so important. Your brain automatically kicks this into gear when you're moving throughout the day. So you really are engaging this muscle constantly. It is such a huge player in stability, but also in allowing ease of motion of your arms and legs and your limbs. Since we've been talking about the transverse abdominis muscle, we thought this would be a good time to teach y'all how to activate this muscle. So everyone pull out your yoga mats, your pillows. We're going to give everyone a minute or so to get situated and set up for this exercise. You want to lie on either side, because we're going to do this on both sides, and we'll walk y'all through that in the videos ahead. But lie on either side with your head supported on a pillow, hips, knees, and ankles stacked on each other, hips bent, knees bent, just comfortably resting on your side. We'll give y'all another couple of seconds to get situated, and then we'll play the video on the next one.
So we're just going to give everyone another minute or so, get situated, get comfortable on your side where you can still hear us, see us, and then we'll do the video. All right, you ready?
So we are going to begin an exercise lying on your side that is going to specifically target the transverse abdominis muscle. So you're going to lie on your side, as we showed you in the previous pictures, with your head comfortably resting on a pillow, hips stacked, knees slightly bent, and hips slightly bent. So in this position, you're going to take a deep breath in and out. You're going to pull your belly button straight back towards your spine. And then release it about 70%. I know that sounds weird and arbitrary. Just kind of feel out wherever that may be. Release it there. And I want you to keep breathing, but we're going to hold it for 1, 2, 3, 4, and release. As Kelly is demonstrating, you can put your hand along the front of that hip, pelvis area to feel. Sometimes you're not going to feel much of anything until you let it go, and then you're like, oh wow, something was actually kind of working in there. So we're going to do it a couple times on this side, and then we'll give y'all a minute to resituate and flip to the other side. So let's go through the sequence again. Take a deep breath in and out. Pull your belly button straight back towards your spine. Release it about 70%. We're going to hold it there for 1, 2, 3, 4. Relax. Good. Let's try it one more time. So deep breath in, out. Belly button straight back. Release it about 70%. Keep breathing. 1, 2, 3, 4. Release. Good. Take a break, and we're going to flip over to the other side in the same position and setup.
So as y'all are kind of situating over, we just wanted to give y'all a little bit of info on some of that. So the whole releasing at 70%, there's a reason that you're doing that. When you pull your belly button straight back, a lot of those muscles around that core and around that abdomen all like to engage. So by releasing at 70, you're really trying to isolate that transverse abdominis muscle. Although you can never really truly isolate it, you're kind of eliminating all of these other layers to try and target that muscle a little bit more specifically. The breathing portion is so important in this too, because you want to make sure that you're not bearing down and increasing that pressure inside of that core cylinder that we've talked about. You want to be engaging these muscles while you're breathing and kind of retraining those pathways, the breath and the core muscles working together. What I usually tell patients in the clinic too, when you're doing this, you know, later tonight, as you're doing this throughout the rest of the week and weekend, do this in front of the mirror. Look at your belly button as you pull it straight back. When you pull it back, that belly button should just move straight back towards your spine. So you shouldn't see your belly button rising up or dropping down. It should be going straight back. And that's how you know you're really targeting that transverse abdominis muscle. Also, we're going to flip over and do the other side. So be conscious of making sure you're not engaging your glutes, squeezing your butt cheeks, you know, straining your neck muscles or doing anything like that. So hopefully everyone's situated over now, and we're going to start the next side.
So now we're going to perform the same exercise on the other side. It's important to flip on both sides to do this, so that we're activating both sides of that big transverse abdominis muscle equally. We want to make sure both sides can activate in the same manner. So same sequence as before. We're going to take a deep breath in and out. Belly button straight back towards your spine. Release it about 70%. And we're going to hold for 1, 2, 3, 4, and relax. Good. So we're going to do 2 more of these. So see if you can try the sequence by yourself now. Hold 1, 2, 3, 4. Relax. Good. So one more time. Deep breath in, out. Belly button straight back. Release it about 70%. Hold it there for 1, 2, 3, 4. And release. Good.
So now we're going to try and make this exercise a little bit more functional. So everyone kind of get yourself up off the ground. Find the chair that we had mentioned in that email, something firm preferably. And we'll give y'all a minute to get situated and pull up a chair next to the computer. All right. Y'all ready?
So everyone gets situated on their chair. Go ahead and scooch to the edge. And we're just gonna see how you feel when you stand up from a chair. So everyone go ahead and stand up, however you feel comfortable, and then sit back down. And let's do this 1 or 2 more times. So I just want you to kind of get a feel for how things are moving, what you're feeling. Good. So now what we're going to do is we're going to get that transverse abdominis muscle engaged and working. And I want y'all to also tune in here and see how you feel standing up with that muscle engaged versus how you were just now doing it. So we'll go through a little sequence again in sitting. So everyone, deep breath in and out. Belly button straight back towards that spine. Release it about 70%. And then in that position, I want you to go ahead and stand up. So holding that transverse abdominis contraction. Good. And then sit back down and release. So hopefully you felt a little bit more support and stability and hopefully a little bit more ease of motion with that muscle engaged. Let's do a few more. So this time, I want you to see if you can just pull that belly button straight back. We're going to skip all the breathing steps. Make sure you're not holding your breath and go ahead and stand back up. Good. And then back down and release. Take a second to reset, kind of see how things are feeling. We're going to try this one more time. Again, belly button straight back towards that spine. Make sure you're breathing. Nice and easy. Stand back up and down and then relax. So this is a good thing that you can try at home when you're getting up from a chair, when you're sitting in your car. This is an exercise and activity that you can really do at any time during any of your daily activities. So here we have written out for you the steps on how to perform the transverse abdominis contraction exercise. At the beginning, it's good to go through all of these steps to make sure that you're engaging that muscle correctly and that you're not compensating or using other muscle groups. So this may be just good practice to get into as you're starting out. But eventually, the ultimate goal is for you to be able just to engage that transverse abdominis without having to breathe in, breathe out, pull the belly button, going through all those steps. But practice this at home. It's easy to practice laying down, sitting in your car, standing and washing dishes, standing to brush your teeth. But here you have it all written out for you step by step in case y'all want to refer back to this. Now that we've talked about the transverse abdominis muscle, let's talk about the other really important core muscle called multifidus. So sometimes we'll refer to the multifidus as the laces of the corset, and you can kind of see why in these pictures. But the first thing to note about that multifidus muscle is that it is so deep right up against that spine. If you look at the picture in the middle, the muscles on the left side of that picture are the outermost muscles. And then on the right, they've kind of taken those levels of muscles out, but you keep going down even underneath all of that. And you can see in those other pictures on the outside that the multifidus runs flush up against that spine. It starts all the way up in the neck and actually runs down to the sacrum. So the sacrum, for those of you that may not know, is this little triangle bone that connects the end of your spine or your lower back to your pelvis. So you can kind of see it on the right side. That little triangle bone is that sacrum. But that muscle spans your entire spine. What's also very cool about this is that each little muscle actually spans 2 to 3 spinal segments at a time. So you're getting a lot of overlap from this muscle as you're working up and down the spine. You can see how that would give the spine a lot of stability and support. It's the closest thing to it. So
The thing about the multifidus is that it is constantly active when we're in upright postures. That is constantly firing to give support in that spine, the neck, the mid-back, the lower back. It provides a lot of stability and support that's so important for our daily function. So what's also cool about the multifidus and transverse abdominis muscles is that these muscles actually contract together. So imagine that big transverse abdominis corset muscle and those little bitty multifidus muscles running up and down the spine, all contracting as a unit. They actually contract together to provide that stability component to the core and the back. So we keep talking about stability. What does that even mean? It basically means that when these muscles contract together, they stiffen the trunk and the spine. This allows for better movement in the arms and legs. And because they function differently than muscles in the arms and legs or the extremities, we have to train them a little bit differently. Muscles in the arms and legs are meant to produce motion and facilitate motion. Well, these muscles are actually meant to stabilize and support and stiffen. Reiterating the importance of these muscles as we've kind of walked through, and you can see, anatomically where they lie in relationship to the spine and the trunk and all these joints, how that actually can give so much support to the body. But not only proper activation of these muscles is important, but endurance is, because again, these muscles are functioning throughout the day. Think about how many times you move your arms and legs throughout the day. All of these muscles are activating before you do that every single time. They're so important for daily activities. Anytime you're sitting, standing, stand up from a chair, you walk, you reach, you're squatting, you're climbing steps, almost everything, these muscles are firing. So that's kind of why we keep coming back and emphasizing how important these muscles are and how cool some of this is.
When we look at how all of these parts function together, we really see a puzzle. It's very dynamic, very interdependent. So the transverse abs is a puzzle piece. The pelvic floor is a puzzle piece. So is the diaphragm. So is the multifidus muscle group. Whenever we have all of these working parts functioning together properly, the puzzle is complete. But if we have one piece missing or dysfunctional, then the puzzle will never be complete. So each part is interdependent on the others for its full function in the core.
Since we have talked about these core muscles and what they do, what their function is, we've looked at them anatomically, and we've talked about why they're so important, we need to talk about what happens during injury. Specifically, we're going to talk about the multifidus muscle. So the research out there shows that when you have an acute lower back pain episode, the multifidus does not recover on its own after this happens. So essentially that pain shuts down that multifidus muscle while you're in it, but it also doesn't just come back on its own. The research also shows that that multifidus muscle actually atrophies on the side where you experienced the pain. So what is atrophy? I included a picture here to kind of give you all a little visual. So this is an elbow, and that muscle right there you see is a bicep. So the one on the left is normal, the one on the right is atrophied. Essentially, atrophy means that that muscle is wasting away or shrinking. So this is why when we see people in the clinic, we immediately start to address this multifidus muscle if they've experienced lower back pain at any point in their life. It's a muscle that needs conscious retraining and reactivation, especially after a lower back pain episode. We need to kind of wake that muscle up. So not only does it atrophy and not only does it need conscious retraining, but they have found that with injury, these muscles actually are not activating well. Their activation pattern becomes altered and almost delayed. So think about how that multifidus lies along the spine. If you have a couple of segments there where you experience the pain and it kind of shuts off, think about all the stress that is going to that part of your spine as you're moving throughout the day. So this is why we love to mention this muscle. This is why it's so important for y'all to be aware of this, because if you have a lower back pain episode, it's important for you to go see a PT so we can make sure to get this muscle firing and active again so that it doesn't create more problems down the line. So we found this really cool MRI picture that we wanted to include to kind of give y'all a little bit better visual of what happens to that multifidus muscle. So what you're looking at is a lower back spinal segment. So that rounded little shape with the arms is your spine. And then if you go down in the picture, you're actually moving towards your back. So those little meaty things on the bottom, those little roundish shapes, are actually your multifidus muscle. So what they're showing here is these are different levels of injury to the lower back. You can see as it gets worse and you move to the right in these series of pictures, there's more of this white matter instead of that nice dark muscle tone. So that just, again, shows kind of how bad it can get. Look at the muscle mass in the first picture compared to the third picture. There's a lot less of that darker muscle tone there that's happening.
In the big picture, we want you to remember that a healthy core and a healthy pelvic floor lead to the prevention of low back pain and injury to the extremities. So basically, as you're following a preventative wellness program, and you're taking care of these core muscles, and you're strengthening them, making sure they have the proper mobility and relationships with one another in place, you are effectively allowing your body to prevent the risk of injury through your lifetime. So it's why it's very relevant to do this type of exercise approach. And as physical therapists, we would definitely prefer to see all of our patients before the injury occurs. There's so much that we can work on in a wellness method where we want to be able to isolate certain muscles that are not performing efficiently, look at postural patterns and tight muscles that need a little bit of help even before they're hurting. So whenever you see a PT and you seek help for your body well before the injury or the pain happen, then you can get better faster, the recovery is quicker, your muscles respond more effectively in that process.
So Q&A time. You'll get a little breather right now too. But we have gotten a few questions, so we want to address some of those. Someone asked while we were doing the sit to stand with the transverse abdominis if you're supposed to release your belly button 70% for that. Anytime you're engaging that transverse abdominis, you should kind of release it to that point. You should always, as you do it more, you're going to get more comfortable to where you're not having to go through all those steps and say, all right, all the way in, release. You should be able to find where that zone is and just engage it from there. But yes, anytime you're engaging that transverse abdominis, do that release if you feel like you're starting from the back point.
And our other question was about the sacrum. To be able to understand what the sacrum is it a muscle or bone? So the simple answer is it is a bone. I'm grabbing our pelvic girdle model in our clinic right here. So this is the sacrum right here. It's a triangle shaped bone. This bone is separate than our pelvic bones on the side right here, the ilium. So this is where your hip fits in. This is where the ilium rounds back, and this is the sacrum, the very bottom of the spine, and the sacrum contains the tailbone at the bottom of it. So that gives you a little anatomy detail, but we will be going more in depth with that on next week with the content for the lower back.
Yeah. So if you have any more questions, send them through. We'll answer some as we go, and then we'll do another Q&A at the very end. So hang in there. There's a few more slides, and then we're going to just do exercise.
We may be going a couple of minutes over just to inform you now to get all the exercise work in.
All right.
Let's talk about diastasis recti or diastasis recti. It can be said both ways. What diastasis recti is a separation in the connective tissue that is at our midline, in between the muscles of the rectus abdominis. So as you can see in this diagram, the six-pack muscles on the left and right side of the abdomen, it's this more shallow layer of muscle tissue. In between, you have the linea alba, and this is fascia or connective tissue. It is soft tissue that connects the muscles. Whenever we have undue stress on that linea alba tissue, sometimes there is weakness in that connective tissue
that allows it to open or separate. And that is what a diastasis essentially is a separation there. Diastasis recti is caused by increased intra-abdominal pressure on this tissue. And so it's common during or after pregnancy. But it can also affect men, and it can also affect infants. So it doesn't necessarily always affect pregnant women only. Cases that occur in men are usually due to some either genetic inherited weakness in that tissue or poor performance of sit-ups, doing crunches improperly and high repetitions. And so increasing the abdominal pressure on that weak tissue layer can definitely cause it to bulge or separate. And during pregnancy, the case is that the tissue does get stretched out from the growing fetus, and pushing down during a vaginal delivery can also lead to a growing diastasis recti. Sometimes this will correct itself after pregnancy. So there are certainly cases that will not need intervention in order to heal normally with that linea alba. But there are cases that do need therapy, and we will go through an example of a case so that you can do a little self-test on yourself to know. In the past, body mass index or weight gain during pregnancy, the weight of the baby, and maternal age were all considered risk factors for diastasis recti. But a study in 2015 found no connection between these factors in pregnant women being more or less likely to experience the condition. So what this means is that the distance between your recti muscles is not likely to change very much after 8 weeks postpartum unless you do something about it.
So as Kelly mentioned, a diastasis recti is the splitting of those rectus abdominis muscles or splitting of that linea alba tissue. Visually, what you're going to see is an indentation along the midline of your trunk, so along that linea alba. When you go to engage your abdominals, what will happen too is you're going to notice a bulging along that same midline area. So going along the thought of the path of least resistance, if you're trying to bear down your abdominals, and you have a split in the middle there, all that tissue underneath is going to see that as kind of the weakest point, and it's going to bulge out from that point through. So when we're talking about diastasis recti, there's usually 3 areas that you look at it to measure it. So you look at it above, at, and below the navel point. The point at the navel or the belly button tends to be the weakest area for this. Some of the research was saying that about 6 or more inches is considered an actual diastasis recti, but anything more than 2 finger breadths or 2 finger widths is considered to be abnormal as far as the splitting in that area. There was a study done in 2009 where they actually used ultrasound to look at the width of that linea alba in 150 women who had never given birth. They were all between the ages of 20 and 45. So they actually measured the linea alba at 3 different points. So the first point was at the xiphoid process, which is actually the notch right underneath your sternum, kind of where your ribs meet in the front. They also looked at it 3 centimeters above the umbilicus and 2 centimeters below. So what they found the average width to be was, of that linea alba at the level of the xiphoid process, it was about 0.3 inches. Above the umbilicus, it was about ½ an inch, and below was about 0.3 inches. So that's what they found to be kind of normal in these women who'd never given birth or had any kind of diastasis recti before. They considered any widths wider than this to be abnormal. So that's kind of a good reference point to think about that, because 6 inches is a lot, and you can have dysfunction even below a 6-inch marker or separation there. Why does this matter? So we talk about this because, we've been talking about the core as this cylinder, or you can think of it almost like a soda can. So when you have this weakness of the abdominal wall, that's going to affect a lot of the pressure in the cylinder system. So think about a soda can. If you kind of puncture a hole in it, that's going to affect all the pressure within that system. If you stretch out a part of that as well, it's also going to affect that pressure system. So this can lead to issues in the pelvic floor musculature. Clearly, it can lead to issues with your breathing patterns. Again, having that kind of weakness point in the cylinder of all of these muscle groups. So it's important that if you do have a diastasis recti, not to bear down, not to hold your breath and kind of bear down and engage those abdominals, because you're going to get that kind of protrusion out. And it's not going to help the weakness point in that area. Another thing to consider is when you're getting in and out of bed, try rolling on your side, to avoid that bearing down if you're just trying to sit up as well. Giving your abdominal areas some support when you're coughing or sneezing can also be helpful as well. So just some things to think about, because many women do experience this after pregnancy. Sometimes it will resolve and sometimes it won't, but it's just good to know what the markers are and what is considered normal and maybe what's not considered normal and when you need to seek some treatment for it.
So exercise time. We're gonna give y'all a little minute, but everyone gets set up on their yoga mat. The first thing we're gonna do is you're going to be lying on your back. So if you're pregnant or you're unable to lie on your back, this is the time to pull out multiple pillows so you can kind of be in a reclined position. So pull out your yoga mats, pull out your pillows, and just get situated on your back. And we're gonna give y'all a minute to get situated. All right, are y'all ready to get started?
Let's get ready for pelvic tilts. So everyone get their yoga mats out, get your pillow, start to get situated. You are going to be lying on your back with your head supported on the pillow, knees bent comfortably. The picture on the left we have just to show you, it's a pelvic model from the side. We're actually going to play a video first that shows me with the pelvis, just rocking it back and forth to give you an idea of what's actually happening and how to do the exercise. And then the next video will actually be the exercise piece of it. So y'all will have a minute to kind of get situated, to get comfortable, to get familiar with the motion. But just get set up and we'll get started in just a minute.
So just so y'all know, this exercise is going to engage some of these core muscles that we've been covering tonight. It's also to help improve mobility of the lower back and the pelvis. So this is kind of a good general exercise. We have a lot of our patients start these. So one more second and we're gonna get started.
Okay, so this is our demonstration with the skeletal model of how to do a posterior pelvic tilt. Christina is holding the model to show you how your skeleton moves whenever you tuck your pelvis posteriorly. What you're going to feel when you do this exercise of pelvic tilting is that your low back is going to actually flatten out against the ground. Any curvature that remains in your lower back is going to flatten with your lower spine. As the pelvis tilts backward, you're going to feel the tailbone tucking upward and inward, and it's going to help your transverse abdominal muscles learn how to engage properly. It's also going to help later down the road when we explore more of the pelvic floor with people recruitment. So right now, looking at the model, you can see the motion that we're trying to achieve through your lower pelvis, lower back area. As the pelvis rocks backward, your low back tissue flattens into the ground, your tailbone tucks upward. And this is the posterior pelvic tilt. This is just to give you the best demonstration visually of what your body is doing. In the next video, we're going to practice doing it. Okay. So this exercise is the posterior pelvic tilt. Christina has her hands right on the edge of the pelvic bones on the left and right sides, so you can feel what your bony skeleton is doing as we do the exercise. It gives you better feedback. So what I want you to begin with is a deep breath into your belly. And as you exhale, tug your pelvis back, rolling the low back flat into the ground. Tailbone tucks upward and inward. And then release that. Inhale. With your next exhale, tuck it back again. Let the lower back flatten. Engaging the transverse abs this time. Pull that belly button in to exhale all the air. Get ready to inhale and relax. As you relax, you're going neutral. As you exhale, you're tilting back again. So finding your own rhythm as you follow along too. So you can find your rhythm with your breathing. Your exhalation is engaging those transverse abs to pull your belly button straight towards the spine. Your inhalation is relaxing the abs and the pelvic floor. So once again, back on rhythm, inhaling, exhaling as you tuck your low back flat into the floor. Inhaling, relaxing the pelvic floor. Exhaling, activating transverse abs, rolling the pelvis back. We'll continue this repetition so you get the hang of it. It's a lot to work with. You're breathing out as you tilt back. You're breathing in as you relax everything. You're breathing out as you tilt it back. You're breathing in as you relax everything. Being aware that you're not clenching your glutes or your hamstrings as you tuck your pelvis back. So we really just want your transverse abs working actively right now with the exhale. This portion of the exhalation where your low back is flattening is engaging your core properly with the exhale with the posterior pelvic tilt. And the inhalation is where you can relax everything again. So you just keep repeating contraction, relaxation, contraction, tilting back, relaxation, breathing in. Later on, we'll integrate this with your pelvic floor. But for now, we want to focus mainly on the abs and the pelvic tilt motion itself.
So next we're going to try pelvic tilts in a standing position. Go ahead and find some wall space and stand up against the wall with your back on the wall and your knees slightly bent. This is a really great exercise for our pregnant moms out there. It helps to unload some of the pressure on your lower vertebrae and your lower back where there can really be some tension build up during the day. So in this picture, you can see the start position on the left with that natural back curvature, that C rounded curve coming off of the wall. That's just at ease. And then the picture on the right is the end position. That's the position you want to achieve whenever you tilt your pelvis posteriorly into the wall and you're flattening out your spine.
Okay, so we're going to practice the posterior pelvic tilt in standing. With your back against the wall, knees slightly bent so that your legs are relaxed, and the arch of your back, I want you to feel into that arch. That is the space that we are going to flatten out. We're going to use your transverse abs here actively to tuck your pelvis back into the wall. So take a deep inhale. As you exhale, tuck your pelvis back into the wall, flattening out the curvature of your back with the exhale. Relax everything with your inhale. Tuck back with your exhale. Flatten out the arch of the lower back as you exhale. As you inhale, your spine is coming back into neutral, allowing that curve. And then as you exhale, your pelvic tilt is going backward to flatten the arch. So along with your breathing rhythm, again, just like we did lying on the floor, your breathing rhythm is going to dictate your pelvic motion here. As you exhale, contract those transverse abs, belly tucking in tight. As you exhale, relax the transverse abdominals. As you exhale, tuck the belly in tight. As you inhale, relax everything. As you exhale, tuck the pelvis, flatten into the wall. As you inhale, relax.
Okay, so we're going to talk you through the forward plank setup. Go ahead and find your mat position again on your stomach. And just like the picture on the left, you're going to prop up onto your forearms. If you have any wrist issues here, be sure that you have a neutral wrist position. In the photo with my fingers curled, my wrists are in neutral, if that's more comfortable for you. It might be more comfortable to lay your palms down flat with your fingers splayed out on the floor in web position too. So just find your position of comfort there. And if your low back is uncomfortable here, you want to try to ease into this position. So that is an arched position we're starting in. Remember that your glutes are really going to be firing in this exercise, and this is why we want to do plank for the lower back, because the glutes get a good benefit from it, and your glutes are also protecting your spine. So in the arched resting position, if you're a little bit uncomfortable, if there's no pain there, go ahead and try the plank. As your glutes fire, the low back discomfort might relieve itself. If there is pain in that setup position on the left picture, then don't go through with the plank. You can talk to one of us through question and answer or shoot us an email, but we don't want you to do a painful exercise. This is okay to do if you're pregnant up to 4 months, in the first trimester into the 4th month. If you are more than 4 months pregnant, please don't perform it. So we just don't want to put any undue strain or stress on the lower back and on those tissues that are changing.
This next exercise we're going to do is a forward plank. I'm sure many of you have heard of this exercise before or performed some version of this before, but we want to review this with you because we feel this is a really great exercise for overall core stability and strength. It teaches good patterns in those core muscles that we've been covering today. So the most important thing with this is form. As you're doing this, we're going to talk you through it, but we're going to shoot for 10-second holds. If you feel as you're holding this position, it is too much and you need to relax, by all means, release, take a break. If you've been doing planks before, or you know that you can hold it for longer, you can absolutely shoot for 20 to 30-second holds as well. But for the purposes of this class, we're going to keep it at 10-second holds. So everyone kind of get on your hands and knees, or your legs and hands, and we're going to elevate up into that plank position. We're going to hold it for 10 seconds. So as you can see, Kelly needs to bring her bottom up a little bit. Good. So you want to make sure you're not having that dip in your lower back, or that you're hanging on that lower back. You want to keep those glutes activated, that core activated, head in a neutral, relaxed position. Make sure you're breathing, and then we're going to release it down. So everyone relax. Take a good breath in, out. Take a second to kind of shake it off, maybe reposition your arms if you felt like you didn't have good support. And then we're going to kick back up, so everyone get back in position. Good. So again, making sure that line is straight. The whole trunk should be in line with the legs, keeping everything nice and stable. Make sure you breathe, don't hold that breath, and relax it down. Good. Again, take a break, take a few breaths, and this will be the last one. So ready, and everyone up. Good. Make sure that glutes up. Good. Keep breathing, everyone. And relax. Great job, everyone.
We're back.
Everybody take a breather. Hope you didn't work up a sweat doing planks. So one point we do want to mention here in the wrap up, and by the way, get us your questions right now. We have our Q&A box open. So if anybody has questions, it's a great time now to type it in. But we do want to mention pain during exercise. So you definitely, like we said before, you don't want to have pain during these exercises. And if you are, stop them and contact us. in a patient setting in the clinic, it's within such an intimate role in the clinic that we play with our patients. We're guiding them. We're doing direct supervision of everything that they're doing. And you guys are at home doing this alone without a PT watching you. So you have to be your own best guidance here and know that if you are having symptoms or pain, then stop what you're doing and contact us. That's what we're here for.
For sure.
If you are not in town locally to come and see us, if you need an assessment, then we will get you in touch with the PT in your locale. So definitely reach out. These are not exercises meant to treat pain, and we're definitely not trying to diagnose issues through virtual online community here. So reach out when you can. Any questions at all? So here we go. Let's see, Christina, should we take this? Okay, we're taking a second to read through our questions so we understand it fully so we can answer it for the audience. Okay, so this question refers to slide 5, a photo on slide 5. Let's get our handout and see. We want to make sure that we're getting clear on this question before we answer it about engaging your abs. It's a very good question. We just want to make sure that we're referencing the correct material in our webinar. Okay, so we're slide
On the right side, third photo on the right.
Okay, like the multifidus then. So the question is about engaging your abs whenever you're lying on your back, and noticing through the years that towards the end of ab workouts that they feel kind of like they're more relaxed, it seems that the question says.
Or they're like mounding up. Maybe this is more like diastasis.
So for the person in our class who sent the question on how the abdomen feels and looks when you're lying on your back and you're trying to activate it, just shoot us a more specific question and we'll be able to answer it.
Yeah.
Sorry, we're not quite sure what you're asking, but I think it is about diastasis, and we can go into that a little bit later on the beginning of week 3. So we can definitely address that with the group then once we get some clarification.
And generally speaking, if you're doing any kind of ab work and you're noticing like that mound, like we showed in that diastasis picture, even if it's not that severe, if you're noticing that it's kind of like mounding up, then you're probably not engaging those deeper muscles very well. You're putting a lot of stress on that outer layer. So it could be that you're fatiguing out and then it is kind of coming through that way. But, you know, doing that transverse abdominis that we did, even when you're doing like core ab work, you know, more for that 6-pack might help with that as well.
Yes, and with diastasis recti, the picture that showed the mounding middle at the linea alba, that myofascial tissue that separates to cause it, whenever you are lying at rest on your back, you can perform a sit-up yourself. That's what we would ask a patient to do in our clinic. And we would say, go ahead and do a sit-up, and we palpate the linea alba at the midline of your belly button. And you can feel a few of those anatomical spots like Christina mentioned in her slide, above the belly button, at the belly button, below the belly button. And just feel with your fingers if there's a large gap there whenever you do sit up. That can be a mild diastasis. If you're bulging there, like the picture on the right in our slide that showed diastasis, if you have a big mound and a big bulge, then that's a more moderate to severe diastasis. So there's more width and separation at the linea alba. So you can easily check yourself at home, but in this case, it does take a clinician. It takes a trained professional, either an OB will check you in office, or a PT checks the anatomy too. So if you're questioning it, it's best to see a professional. And that comes into relevance with what Christina was mentioning. You don't want to be bearing down and lifting heavy objects and having your diastasis bulge out with you. So there are ways to train it for intervention and treatment methods that can approach that to help your diastasis be more supported. Those deeper lower muscle layers are the support structure for that. And they can learn to take hold where that separation has become weak.
So starting with that transverse abdominis exercise that we did tonight is a good starting point. That's where we start people in the clinic who have diastasis recti. But knowing that there are progressions beyond that, that you would need somebody supervising you to help. But even starting to engage a transverse abdominis should help with that a lot.
Yes. I hope that answered your question.
Yeah.
And we also have one question about breathing exercise combined with the pelvic tilt. So we took you through a few of those repetitions so you could get the feel of how your inhale can come into a relaxed pelvic floor and relaxed belly. That is when your spine is more in neutral, or the relaxed curvature of the spine. So where your lower back has that natural C-curve shape to it, inhaling into that. And then exhaling is going to be tucking the pelvis backward. That's where your back straightens with the exhale. So the actual movement in those two forms of exercise is with your exhalation and with your back straightening and flattening. That's on the floor and the wall.
So just knowing anytime you're engaging a muscle, kind of reiterating some of the things we said last week, anytime you're engaging a muscle, you should be breathing out, generally speaking. So as you're tucking back, that should be the out breath.
Yep.
So
wonderful, everybody. Thank you so much for those questions. We love to interact with you. And again, contact us if you have any more in-depth questions. We'll definitely get to that beginning of week 3. We cannot wait to unveil week 3 for you. Y'all are going to love it. It's going to go deeper into the low back issues, the gluteals, the hips, and the pelvis. So we're continuing to dive down a little deeper from diaphragm to core, down into pelvic floor for week 4.
Exactly. And also, if you were signed up for the live class, we sent an email out, I think at the beginning of this week or last week, I can't remember. But to sign up for like a certain date, if you haven't done so, please do so we can kind of set the dates for everyone and everyone has ample time to plan for that. If you didn't get that email and you are signed up for the live class, please email one of us and let us know so we can resend it. Maybe it dropped into your spam or something. But if y'all have feedback or anything else as well, please feel free to contact us. Thanks for hanging in there with us tonight. We went a little bit over.
Thanks for your extra time. And remember to definitely check your inbox, because if you don't have your handouts printed out, they're in your email, as well as an exercise sheet from tonight that's an easy go-to reference with pictures.
Yes.
We'll see y'all next week.
Good night, y'all.